Hello students, now we are going to discuss another significant developmental disorder or pervasive developmental disorder, that is Rett syndrome. Rett syndrome has close similarities with autistic disorder, however, there are certain differences too. Rett syndrome is also a neurodevelopmental disorder as identified by DSM-4-TR. It is to some extent related to autism, but babies with Rett syndrome generally seem to grow and develop at first in a very normal way. However, between 3 months and 3 years of age, they stop developing and even they lose certain skills whatever they have learnt. Rett syndrome as a developmental disorder is first identified by Dr. Andreas Rett, who first discussed about this syndrome in 1966 in a medical journal. It was found that this syndrome, Rett syndrome, is more frequent, more common in females compared to the males, and this is typically a degenerative course. However, in few cases it was found as a genetically related disorder, but in other cases no genetic trace was found for this particular onset of this disorder. What are the symptoms of Rett syndrome? The first symptom which is very much evident is slowed growth. The growth of the child in various developmental aspects has slowed down. Initially, child has a normal brain size before the birth, but after the birth it has become very apparent that there is a reduction in the development of the brain functioning and also in the size of the brain. Smaller than normal head size is usually the first sign that is noticed among this particular disorder, and this particular symptom becomes evident after 6 months of age. As children with this syndrome grow older, there is a delayed growth in other parts of the body also, and this becomes very evident. Another symptom is loss of normal movement and coordination. The most significant loss of movement, that is motor skills, generally occurs between 12 to 18 months of age. The first signs include a decrease of hand control and also the decreasing ability to crawl, to walk and to just move certain steps normally. So, the first signs often include a decrease of hand control and also the ability to walk and also to run normally. At first, this loss of abilities occurs rapidly, but then continues to lose these skills very gradually. Another symptom of the Rett syndrome is loss of communication and thinking abilities. During the ages 12 to 18 months, children with Rett syndrome tend to lose certain speaking skills. They cannot speak properly, and whatever they have learnt also it is very difficult for them to reproduce, use the communication skills. And not only the speech, communication in other ways is also lost. They cannot communicate not only verbally, but even using the gestures is reduced. They cannot use the gestures as a communication. They become disinterested in interacting with other people or in using the toys and also with regard to the surroundings. Some children show rapid changes such as loss of speech, whereas in certain cases this loss is very gradual, it is not very sudden, it is not very rapid. However, slowly some children try to regain the eye contact and also try to use non-verbal communication skills, but this is found only in few children, but not in all the cases of children suffering with this kind of Rett syndrome. Another important symptom is unusual eye movements. Among certain children with this Rett syndrome, we see certain abnormal eye movements like rapid eye blinking or eye flashing or closing one eye at a time. Very frequently they do it for no apparent reason. Another symptom of Rett syndrome is breathing problems. Breathing problems also look very abnormal, and these problems generally occur during the waking hours, but not during the sleeping time. So, these breathing problems include apnea, that is holding breath. They cannot take their breathing pattern normally. So, they hold their breath for a few seconds to a minute. and sometimes abnormally rapid breathing takes place, that is hyperventilation, and in certain cases they show forceful exhalation of air or saliva. So, these are certain things where we do not find in the normal children, but when children are suffering with this disorder, some of these symptoms may also be evident, that is breathing problems. Another significant symptom associated with this disorder is irritability. Children with Rett syndrome are highly irritable. Increasingly they get agitated. As they get older, these symptoms become more prominent, that is restlessness and irritation increase as they are growing. Sometimes periods of crying or screaming without any reason is also very much evident. Once they start crying, it is very difficult to stop their crying spells, and the reason for the crying spell is also unknown. Suddenly they start and they try to continue for a longer time, either it is a crying spell or a screaming pattern. However, these children become much calm when they reach the age of 10 to 12 years of age. Some of these symptoms get reduced, especially the irritability pattern, agitating pattern get reduced when they reach the 10 to 12 years of age. Abnormal hand movements is another reason. As the disease progresses, these children tend to exhibit certain movements, hand movements which look very abnormal. It could be something like hand clapping, hand squeezing, hand tapping, or sometimes rubbing of the hands continuously. So, normally we do not see these patterns in the other children, but when the children has this Rett syndrome, most of the time they tend to use their unusual hand movements or abnormal patterns of hand movement. Apart from these movements which tend to look abnormal, certain behaviors are also abnormal. So, abnormal behaviors is another symptom which is found in this Rett syndrome. Abnormal behaviors include continuous bouts of laughter. Why they are laughing, it is unknown, but once they start, they do not stop it. And they tend to show the odd facial expressions, inappropriate facial expressions, and sometimes screaming occurs continuously for no reason. Hand licking, grasping of hair or cloth also takes place. Either they tend to play with the edges of the cloth or edges of the hair, trying to curl them up or pulling them. So, this is one of the common symptoms. Another symptom associated with the Rett syndrome is seizures. At least 75% of the children associated with this or suffering with this kind of a disorder tend to show the seizures or epileptic attacks. If not, in certain cases it was found like at least half of them who were diagnosed as suffering with Rett syndrome tend to show this epileptic attack. But this epileptic attack can be very mild, or sometimes it is found in a full blown epileptic attack. In some cases it is found as a full blown epileptic attack, or in certain cases it is a very milder form. Another symptom is abnormal curvature of the spine. This is known as scoliosis. Scoliosis is one of the disorders associated with this Rett syndrome. Here what happens is like the spine control, the spine development is not in a linear form, but it tend to bend slightly forward, which impairs their standing or walking of the children in a steady manner. So, this is called as scoliosis, and this occurs between 8 and 11 years of age. Another symptom is irregular heartbeat, also known as arrhythmia. This is a life-threatening problem for many children, because this breathing problems, it is very difficult to anticipate when this kind of a pattern turns up, under what situations it turns up. So, we have to be very careful when the child is showing the symptoms of irregular breathing pattern or irregular heartbeat. Constipation is another significant symptom which was apparent in this disorder. What is the similarity between autism and Rett syndrome? Rett syndrome and autistic disorder has certain similarities. Look at the slide. The similarity between Rett and autism are screaming fits, inconsolable crying, avoidance of eye contact, lack of social or emotional reciprocity, markedly impaired use of nonverbal behaviors to regulate social interaction, loss of speech, sensory problems. These are the similarities which we see in children affected with autism and also children affected with Rett syndrome. One question that often arises is whether Rett syndrome is inherited. Most of the cases, though it was set a degenerative course and it can be traceable to the genetic disorder, in more than 99% of cases the genetic mutation is spontaneous. That means it occurs randomly. Random mutations are usually not inherited or passed from one generation to the next. In a very small percentage of families, we see that is about 1% to 5%, these cases are inherited and they are passed only by the female carriers. So, we cannot completely say whether it is a genetic disorder. So, the controversy is still going on whether can we attribute it to the presence of the gene or whether it is just the mutations. Now, there are different stages of Rett syndrome. Overnight we do not see the symptoms of Rett syndrome, suddenly it will not develop. So, there are different stages. The first stage includes early onset of phase. In this stage, the development stops or slows down. Most of the cases there is no development in this stage. Signs and symptoms of this disorder are very subtle, they are not prominent. So, whether the child is having a delayed developmental process or whether the child is showing any symptoms of a developmental disorder, it is very difficult to trace at this phase. And this phase starts between 6 to 18 months of age. Babies in this particular stage may show less eye movement and they do not show any interest in toys, which is more common for this age group. They also have delays in sitting and crawling behaviors. So, it is very difficult whether it is a delayed development or whether there is any disorder associated with their development process. The second phase is rapid destruction phase. In this particular stage, the child loses the skills very quickly. Purposeful hand movements and speech are usually the first one to decline. So, the hand movements which we use in our normal interactions and even the speech, they try to lessen the use of these things. They cannot remember, they cannot use them in their normal interactions. This phase starts between 1 and 4 years of age, and during this particular phase they lose the ability to speak and also communicating through the non-verbal means. During this stage we can see certain breathing patterns, abnormal breathing patterns like holding their breath, that is apnea, or hyperventilating, that is trying to inhale the air more rapidly, or certain crying spells and also the screaming patterns more often in this particular disorder. But why they are doing it, what is the reason, it is very difficult to trace it. And during this phase we also notice that the mobility is lessened, they cannot walk on their own, they have to depend on someone's support. So, these are the symptoms which we see in the rapid destruction phase. Next stage is plateau phase. In the plateau phase, the regression slows down and other problems are also lessened or either improved in a better way. Most of the children with this Rett syndrome spend most of their life in this stage 3. It is a plateau stage and this usually begins between 2 to 10 years of age. The problems cannot be completely reduced or cannot be completely minimized, but definitely it is not a worsened situation. Some people may show a slight improvement in their abilities, motor abilities or speech abilities. Children in this particular stage cry less, there are no screaming spells or crying spells, and they also become less irritable. Certain hand movements are improved, eye contacts are also improved, that is children try to regain the eye contact, try to use the hand movements with a particular purpose. So, these skills are improved compared to the previous phases. Late motor deterioration phase, this is another phase in the Rett syndrome. During this stage, individuals may become very stiff or lose the muscle tone, and some of them may become immobile because of this lack of muscle tone or becoming too stiff in their body. So, this stage is marked mostly by the immobility and muscle weakness, which we call it as scoliosis. Because they are unable to walk, stiffness in the muscle, they develop a pattern of scoliosis. Understanding, communication and hand skills generally, that is movement of the hands, generally do not decline, but repetition of the hand movements continues. Although the sudden death cannot occur in this particular stage, but most of them tend to be immobile. Because of their immobility, they cannot have proper interactions, and also they try to confine to the home, which leads them to feel isolated. Most of the people who are suffering with this syndrome, Rett syndrome, tend to live up to 40 to 50 years of life, and they usually need care and assistance throughout their life. So, these are the different phases. Now, coming to the diagnosis, how can we diagnose the presence of the Rett syndrome in the children? The first diagnosis can take place by the physicians, by the doctors. So, by observing certain signs and symptoms as a part of the developmental process or during the developmental process, they can identify that something is wrong with the development of the child, and once they sense that, an evaluation, intensive evaluation can be done on the child to identify whether it is just a delayed development or whether a serious disorder is present. So, the evaluation is done not only on the child's physical status, but also on the neurological status. Scientists have also conducted some research to identify whether there is any genetic attribution to the onset of this disorder. They developed certain tests which can be used as a complement test to the other evaluation tests to identify the presence of MECP2 gene on X chromosome. If this MECP2 gene is present, that is an indication that the child's development, impaired development is due to the presence of a serious neurological problem rather than just a normal delayed development. A pediatric neurologist, clinical geneticist or developmental pediatrician as a team can identify the presence of this particular disorder using the clinical diagnostic tests. The clinicians usually use 3 criteria to identify the presence of this, that is main criteria, supportive criteria and exclusion criteria. So, main criteria, supportive criteria and exclusion criteria are used to see the presence or the absence of the disorder. What are the variants of Rett syndrome? There are different variations in the presence of this disorder. One is congenital variant, also known as Rolando variant. This is a severe type of Rett syndrome where the development of the patient's body or the functioning of the brain is completely retarded, and the gaze, that is the eye contact, is completely absent in the patients affected with this kind of a variant Rett syndrome. The second variant is Japella variant of Rett syndrome. In this particular stage, certain manual skills and eye contact can be made by the patient to some extent. During this stage, height, weight and the circumference of the head can be seen normally, and certain manual skills were also shown by the patient. Eye contact to some extent is minimal. So, this is called as a milder form of Rett syndrome. The third variant of Rett syndrome is Hanifield variant or early epilepsy variant. Generally, in this particular phase, the patient suffers from mild epilepsy, and this is seen even before 5 years of age. In this particular phase, we see the child is suffering from epilepsy even before 5 months of age. Mortality. What is the mortality rate associated with this disorder? Despite the difficulties and the symptoms associated with this Rett syndrome, most of the patients suffering with this disorder tend to live 40 to 50 years of age and sometimes even beyond that. But very little is known about the disorder, and so it is difficult to diagnose prognosis and also about the life expectancy. Though there were many women in their 40s and 50s with this kind of a disorder, very few men are found up to this age. Males with pathogenic MECP2 mutations usually die within the first 2 years from their diagnosis, unless if an extra X chromosome is restored to make them live up to a particular age. Coming to the treatment, there is no cure for Rett syndrome, but certain strategies can be used to minimize certain specific problems associated with the Rett syndrome. Because it is difficult to diagnose, who can really treat this particular disorder? Is it a psychotherapist, is it a physician, or a combination of both? So, it is said to treat the Rett syndrome, a panel of doctors, dietitians, psychotherapists would require. A pediatrician is the one who will first be consulted, because this syndrome is generally seen during the childhood. He is the first one to observe and make the diagnosis. Other experts like gastroenterologists, cardiologists, physiotherapists, geneticists can also be a part of the team. Apart from these people, to reduce the symptoms of temper tantrums, to reduce their anxiety and irritability levels, psychotherapists are essential to modify, to make them cope with the situations. And there are variety of ways to minimize the impact of the Rett syndrome. Most of the studies indicated by restoring MECP2 gene to some extent may lessen the presence of the disorder. Some studies have indicated that by restoring MECP2 gene, to some extent the intensity of the disorder can be restored. They found that factor 1, insulin like growth factor 1, can be included as a part of the gene therapy in order to minimize the presence of these symptoms associated with the genetic disorder or Rett syndrome. Other options for the treatment include medication or any other psychotherapeutic methods. So, medication includes surgery also. Through surgery, the intensity of scoliosis can be reduced, so that they can make more mobile. Patients with the Rett syndrome can be made more mobile if a surgery is done to reduce the intensity of scoliosis. Other medications can be given to reduce the breathing problems and reduce the breathing patterns, and also to regulate heartbeat rhythm. Because they have an irregular heartbeat rhythm, that can be minimized by giving certain medications. And medications can also be used to reduce their constipation problems. Not only the constipation, even the indigestion that is evident in some of the children with Rett syndrome can be minimized by using certain medicines. Calcium and mineral supplements can be provided to these children, so that the progress in the development of the bones can be made faster. And whatever treatment is given to these Rett syndrome children, parents are also made a part of the group. Not only the parents, even the care providers, so that they can play an active part, they can play a vital role in giving the nutrition, in providing them the medication on time, and also in handling them with more psychological care. Rett syndrome is commonly seen in females than males. So, another controversial question that often arises is, to what extent we can make her independent, to what extent we can give her the treatment which enables her to make her feel independent in her day to day life. So, the answer to this is, she will need help for most of the daily activities. She has to depend on the family members or some kind of an assistance, but in simple tasks like feeding herself, washing utensils, she can be trained. She can learn to enjoy the family relationships and friends, which make her mental well-being improve, and this may show an impact in her normal day-to-day life interactions too. Completely we cannot cure it, but when we focus on certain improvements in the mental makeup of the individual, the same can be reflected in her day-to-day behavior, and she can be trained in the simple activities. In that way, probably the girl can take care of certain household chores by helping the mother. So, this is what the experts have felt about training to be given to the girls. To conclude about the Rett syndrome, it is a developmental disorder which is found mostly in the females compared to the males, and we can notice it during the childhood itself, that is the first 3 years of life. Sometimes people say Rett is a degenerative disease, but it is not degenerative, but a neurodevelopmental disorder. If complications and illnesses are taken care, they can have a normal adulthood. We see number of symptoms associated with this Rett syndrome. It could be the abnormal behaviors or abnormal movements, or it could be the high irritation and other breathing problems and abnormal heart rhythm. Overall, the Rett syndrome cannot happen all of a sudden. It occurs in different stages. So, if early diagnosis has taken place, it would be easy for the family members and for also the child to cope with the situations. If it is in the second stage, that is at early destruction phase, certain symptoms are already present, but the onset has taken place, but the impairment has been lessened. In the plateau stage, certain skills can be improved upon, and in the last stage, it would be very difficult to make the child and also the family members handle the situation. So, here at this stage we cannot create any kind of an overnight change, but definitely we can make them cope with the situation. The cause for the Rett syndrome is not completely the genetic, it could be mutations also. So, we have to identify whether it is a normal developmental delay process or the presence of a neurological disorder. Based upon that, early intervention can make the client, can make the family cope in a more effective way. And the treatment includes a different panel like pediatrician, cardiologist, gastrointestinal expert, and also other care workers who can be given glimpses about the treatment strategies, who will be ultimately taking care by providing physical and psychological care to the client.